Well, let's talk more about the relevance of the World Health Organization with Rafael Perez-Escamilla. He's the director of the Office of Public Health Practice and director of the Global Health Concentration at the Yale School of Public Health. Thank you for joining us.
Thank you, Rachelle.
Now, before the pandemic, the WHO Annual Assembly was the world's premier public health meeting. Now, some are calling this year's Annual Assembly the most significant geopolitical summit of 2020. What's your take?
Well, I think that the WHO World Health Assembly will be remembered through history as whether the countries were able to move forward with the plans to make available to the whole world for free testing, treatment, and a vaccine that I am optimistic may be likely to be ready within the next year or so. If the members of the World Health Organization are unable to meet this goal, I guess that the WHO will be remembered for this massive failure.
So then how is the WHO balancing these conflicts between global public health and sovereignty, especially in light of this now independent review announcement coming on about its handling of the pandemic?
Yes. So the World Health Organization is irreplaceable with regards to the capacity that it has to convene all member states, which literally is formed by all the countries of the world. The World Health Organization is an international body belonging to the United Nations that makes best practices, recommendations, that issues guidelines, and provides very, very strong technical assistance to countries with regards to this pandemic and many other public health matters. But it is important to understand that the WHO has no power at imposing into any country following its guidelines or recommendations. It is really up to the nations in the world to take advantage of the wonderful opportunity that the World Health Organization brings with it to actually respect the human right to health for all, especially during this very unfortunate pandemic. So it is my hope that the countries can come together and get this done from the point of view of human rights, from the point of view of their own economic development, and quite frankly, from the point of view of the sustainability of our planet. So no one will be able to impose this on anyone else, but I really don't see any other option at this point other than trying to get it done through the World Health Organization.
So then at this point then, what is the WHO still wanting to get out of the event, and how close are they to getting what they're asking for from world leaders?
So I think, except for the US, there is literally global consensus that this is the way forward. Obviously, the US is a very, very big player. It is a very big donor. We must remember that the World Health Organization Constitution was signed in New York City in 1948, and the US was one of the founding members, one of the strongest sponsors of the World Health Organization. So I really hope that the leaders in the US can rethink their position about losing the leadership for global health responses and other kinds of public health issues globally, because at the end of the day, I think the best diplomacy in the world has been driven by global health.
So just quickly then, as we look at some of the criticisms leveled against the WHO by the Trump administration, is the WHO in need of any reforms to meet today's evolving needs, or do you think they've really kept up with the times and do still have a lot of relevance?
So the World Health Organization obviously is not perfect. Obviously, there is quite a bit of room for improvement. It is a massive organization with thousands and thousands of employees distributed in Geneva and across 6 world regions. But it is very important to understand also that their accomplishments have been enormous in the past. The eradication of smallpox, the strong, bringing under strong control the polio pandemic in most countries in the world, the major advances in maternal and child health and nutrition, in early childhood development, and so on. So the WHO has proven through the vaccines program, the HIV response program, time after time after time, that yes, it may not be perfect, but they have the capacity to get this pandemic under control if all the world support the effort. Please keep in mind also that the whole budget for the World Health Organization is roughly about $2.4 billion per year. That is equivalent to the budget of a large hospital in the US. It is a small fragment of what the budget is for the Pentagon every year, for example.
Right.
So it is important that the countries that want to see this pandemic being brought under control, which thankfully is the vast majority, keep in mind that the WHO needs financing, needs support, and yes, some degree of reform. But at the moment, the issue is not to point fingers and to try to change the WHO in 30 days, but is to benefit from its structure to bring the pandemic under control.
All right, well, thank you so much. We'll have to leave it there. Rafael Perez-Escamilla there, the Director of the Office of Public Health Practice and Director of the Global Health Concentration at the Yale School of Public Health.